Yeah, thank you so much, Beth, for the introduction. Yeah, my name is Jordan Murray, and my presentation today will focus on the health effects of exposure to blue-green algae or cyanobacteria and the public health approach to dealing with related illnesses in Wisconsin. I'm a Wisconsin Water Resources Science Policy Fellow, and I'm contracted through the University of Wisconsin and stationed at the Wisconsin Department of Health Services, where I've been helping lead our state's public health response to freshwater blue-green algae for about a year now. In the picture on the left is Amanda Cook. She is my current blue-green algae mentor, and she's with me today for this presentation. Great, so let's talk about cyanobacteria, AKA blue-green algae. Cyanobacteria are a type of photosynthetic bacteria. They are one of the first organisms, if not very first, that figured out how to make oxygen. And because of that, they've played an important role in the creation of the Earth's atmosphere and water bodies as we know them today. They can be found in most lakes, rivers, and streams. Under certain circumstances, though, cyanobacteria can be a health hazard to humans, animals, and the environment. When environmental conditions are just right, cyanobacteria can grow to form what are known as harmful algal blooms, or HABs. And these can affect aquatic life and people who use the water for recreational or occupational purposes. Some species of cyanobacteria can produce neuro, liver, kidney, and skin toxins that can make people and animals sick if they are exposed. People can be exposed to toxins through a few different ways. So ingesting or swallowing water is the most likely exposure route. And swallowing water with toxins in it could lead to gastrointestinal symptoms like cramps, nausea, diarrhea, and vomiting. Ingestion of neurotoxins can cause symptoms like dizziness, numb lips, tingling fingers, and toes. However, we don't typically see neurotoxic effects in Wisconsin, but when we do, they are typically observed in dogs. And skin contact is another possible exposure route. So if a person comes into contact with algal scum or mats, they might develop a rash, hives, or skin blisters. However, toxins, they're not absorbed through the skin and into the body, so they wouldn't cause symptoms beyond skin irritation. And pictured here is a rash that developed on a foot after exposure to harmful water conditions. And this is actually a case that our program here at DHS investigated. And the last exposure route I want to mention is inhalation, which is the route of exposure when people participate in activities like tubing or water skiing through a bloom. Generally, their mouths are open and it becomes easy for them to breathe in water droplets. When this happens, we might see something like a flu-like illness develop or respiratory irritation, including asthma-like symptoms. Our animals are affected by cyanotoxins too. We've seen adverse health effects and even death in dogs, wildlife, and livestock who are exposed to toxins. Animals are especially susceptible because they aren't as easily deterred from smelly green water as humans are. They also tend to be smaller in size, meaning that it doesn't take much toxin to make them sick. All right, so now I'm going to tell you all a little bit about the Harmful Algal Blooms program at the Wisconsin Department of Health Services. So our program, we exist to prevent and manage blue-green algae related illnesses in Wisconsin. Our ultimate goal is to protect and promote the health of the wonderful people of Wisconsin. Our program started in 2008 because that was the year that the CDC began tracking voluntarily reported cases of HAB-related illnesses. And since then, our staff support has been made possible primarily by CDC fellowships and the University of Wisconsin Sea Grant and Water Resources Institute. And for 14 years, we've worked diligently with state partners to investigate HAB-related illnesses in Wisconsin. This core partnership consists of us, the Wisconsin Department of Health Services, the Wisconsin Department of Natural Resources, and the Wisconsin State Laboratory of Hygiene. And it's always great to put faces to names. So Here you can see 3 groups of people who make these partnerships possible. Amanda and I are at the top, posing with a bloom. On the bottom left is Gina. She's our statewide harmful algal blooms coordinator at the Wisconsin DNR. And on the bottom right is Dawn, our state lab microbiologist. So in a nutshell, our HAB program, we conduct surveillance of health effects related to HAB exposure. We investigate reports of human and animal illnesses. We coordinate water sampling and analysis. We help local public health issue health advisories and beach closures. And we provide education and outreach to local jurisdictions and citizens. So how do these activities fit into a typical illness investigation? Well, let's walk through the steps together. So first, we receive an animal or human illness complaint. We most commonly receive complaints through a reporting tool on our website, but we also receive complaints via phone calls or emails from the complainants or through referrals from the Wisconsin DNR, local health departments, lake associations, the Wisconsin Poison Center, and even clinicians. After our program receives the health complaint, we begin the investigation by interviewing the patient or animal owner. We ask about signs and symptoms and activities and water conditions at the time of exposure to blue-green algae. We then assess the information provided during the interview and coordinate water sampling with our DNR partners. Water samples are then sent to Dawn at the State Lab of Hygiene, who microscopically identifies and enumerates cyanobacteria in the sample and conducts toxin testing. After Dawn analyzes the samples, she reports the results back to me and Gina. And finally, we interpret the level of health risk present and take the steps needed to protect public health. We typically share the water sample results and the health risks with local health officials. Local health can then issue a health advisory, a closing, or restricting access to a beach or swim area impacted by a bloom. Generally, the local health department will work with the DHS HAB program on appropriate messaging, especially to the public regarding HAB health risks. On this slide is an example of a caution sign developed by our program on the left and a press release from a local health department on the right. But why do we care about HABs? Well, they are an important matter to public health for several reasons. So first, we know that HABs are an emerging public health problem worldwide, with areas all over the globe experiencing problems. Secondly, the warming effects of climate change are projected to increase the severity, magnitude, and distribution of this problem in the future. And lastly, the health impacts from HABs, they're still pretty poorly understood. Most of what we know about health impacts comes from animal toxicity studies and anecdotal case reports instead of large-scale controlled epidemiologic studies. And therefore, we really rely on people reporting cases to us so we can learn more about the kinds of signs, symptoms, risk factors, and health outcomes associated with HAB exposure, because having this knowledge will really help us to prevent these illnesses in the future. But in order to learn more about HAB-related illnesses, we do need to hear about them. And unfortunately, illnesses are not always reported to us, and there are a few different reasons for this. So not everyone is aware of what HABs are, what they look like, that they can cause illness, and what kinds of symptoms exposure can produce. HAB-related illnesses, they're also very challenging to diagnose. So most symptoms are so vague that they sound like other conditions like swimmer's itch, food poisoning, or allergies. HAB-related illnesses, they don't have a single signature sign or symptom that clues us in. And in most cases, illness is not severe enough to warrant medical attention. Even in cases severe enough to be seen by a doctor or veterinarian, the level of awareness of HAB-related illness among medical professionals can vary. And therefore, being seen does not guarantee that the practitioner will recognize the illness as HAB-related. There's also currently no commercially available diagnostic tests that the doctor could run, for example, on a urine sample to confirm that your illness was in fact due to HAB exposure. And so together you can begin to understand how all of these factors contribute to a potential underestimation of the number of HAB cases seen across Wisconsin and the country. So what can we do to help prevent bloom-related illnesses? Well, we can become familiar with the signs and symptoms of HAB-related illnesses, as well as risky water conditions. We can educate others about blooms and related illnesses. We can report suspected human and animal illnesses to our local or state public health authorities. We can encourage others to report suspected illnesses. And we can report obvious blooms to our state environmental resources agencies. And finally, you can follow simple precautions to protect yourselves, your family, and your friends and your pets from any harmful effects of blue-green algae exposure. So try not to swim or allow your kids or pets to swim where water is discolored or where you see foam, scum, or algal mats. Don't boat, tube, water ski, jet ski, or wakeboard through algal blooms. Try to shower or rinse off with fresh and clean water after swimming in lakes, rivers, and ponds. And keep your pets out of discolored water or where you see foam, scum, or mats of algae. And if your dog does swim in scummy water, try to rinse them off right away and don't let them lick the algae off of their fur. And always be on the lookout for and respect any posted beach closures and health advisories because they are there for a reason. And if you're ever not sure about what might be in the water, it is always best to err on the side of caution. We like to say, when in doubt, stay out. So this information, along with other useful information, is included in some of the really great resources that our program offers. We offer a fact sheet on how to protect your family and your pets from the harmful effects of blue-green algae. And we also offer one with a photo guide of specific bloom conditions to avoid, as well as a guide to help you differentiate between bloom conditions and their non-harmful lookalikes. And to find these fact sheets and more, you can visit our website at dhs.wisconsin.gov and search algae. And that is it for me today. Thank you so much for listening. I'm happy to answer any questions at this time.
Great. Yeah, we have about 2.5 minutes for questions.
It looks like green algae is an ongoing issue. Any chemical ways or biological ways that we can clean out the algae?
Yeah, so my specific department focuses more on the health effects of blue-green algae. We don't do a lot of things with remediation of blue-green algae. From my understanding, they are ubiquitous and they are present in every water body. So removing them is a very difficult process and not an easy thing to do. But yeah, like I said, we focus more on the health aspects. So not something I'm super familiar in. But good question.
Is there a sense of the relative exposure risk on inhalation versus taking water in the mouth?
Yeah, that's another good question. So swallowing water is the most likely exposure route. We see more illnesses reported to us when people actually swallow the water and ingest it and it gets into their body. This can create a greater risk for illness. In terms of inhalation and inhaling water droplets, there is research and data to suggest that this could result in things like cold-like symptoms like a runny nose or sore throat or asthma-like symptoms, things like that. But inhalation, especially from water droplets and toxins in the form of aerosols, that's still an emerging area of research, and we're still learning about the health effects associated with inhalation.